Hello, and thank you for watching this recorded webinar. Here at the National Healthcare Association, we're excited to share this information with you regarding reports, scoring, and the best way to assess NHA's practice test scores related to the certification exam. We are excited to have you join us to explore this important topic. As educators, there is nothing more valuable than knowing that our learners have been prepared and are ready to sit for a national certification exam. Today, we're going to be covering some primary topics specific around, again, practice assessments, evaluating performance, and some key ways to make sure that you're assessing them using the NHA resources to the best possible capacity. We'd like to go ahead and introduce our speakers today. My name is Laura. I am NHA's Sales and Client Enablement and Training Manager. With a master's degree in adult education, I've been working in the healthcare and education fields for more than 15 years. I specialize in implementation and ensuring that learners are able to grasp the concepts that you're trying to teach them. I'd like to go ahead and also introduce Kelly Cobb. Kelly, would you say hi to everyone today?
Sure. I'm so happy to be here with you. My name is Kelly Cobb. I am a nurse for over 25 years. I have worked as an educator both in the hospital, in a CTE classroom, as well as at the college level. Additionally, I have worked as curriculum coordinator and most recently, director of simulation.
Thank you, Kelly. Okay, so we're going to go ahead and get started specifically with doing an overview of the NHA practice assessments available for you to provide to your learners, an outline of what they are and what they do. The study material package available from NHA does include a series of practice tests. These are designed to follow the full test plan blueprint for that profession and look or feel as close to the NHA exam as we can create it. This is why implementing these too soon in the learning cycle may not be in the best interest for every program. Unlike the other part of the NHA study materials, which include module quizzes, these assessments have a limit on the amount of attempts available. Each practice assessment is followed by the NHA Focused Review, which is a personalized study tool for learners to help each one of them as they navigate through these practice tests. When we monitor student behaviors with practice tests, we find that they really should begin after the core learning has been completed. NHA has actually been launching baseline assessments incorporated into our newer preparation packages to help bridge the gap from core learning to exam readiness and provide visibility to learner growth. But either way, NHA has seen that the first practice exam should be implemented as close to a real exam experience as is possible for you to create for your learners. Some of the NHA materials do this automatically, but you have the ability as an administrator to manually set this up as well. After that first practice test, use the reporting and data to help define your remediation plan for your learners and move through the next few assessments, leveraging the unique focused review tool provided to your learners, tied to each practice test attempt to further their study, along with additional course materials that you may provide. Once you've issued the third practice assessment, then require that fourth exam once again in as close to a real exam environment as possible. This not only provides your learners with real-world experiences of the actual exam, but helps to develop their skills related to test taking and test anxiety. We have seen that students who have at least 2 practice tests and as close to a real exam experience as possible have a higher probability of success on their NHA exams in their first attempt. The practice tests, again, are designed to look and feel as close to the exam as is realistic. No matter which certification, learners are taken through at least 3 independent test versions, which cycle through a total of 6 attempts. Now, just because they get a bunch of tries doesn't mean that they should take them all right away to memorize questions. These are designed to help prepare and study for the exam. Each of those attempts are just like taking the full exam in content, but learners shouldn't expect that these exact questions be on the certification exam itself. They are designed to follow the test blueprint for all scored questions, provide feedback, reporting, and additional tools to help them study. Now, as the instructor, you have the power to turn on or off the instant feedback rationales to help as they prepare. This is what you do for that first and fourth exam attempt to give them that mock exam experience. Even if possible, have them test in a different room, testing center, or require a time limit for those exams. It's not important that they take all of the 6 assessments, more so that they take time to study in between. One of the ways we can help with that is with NHA's focused review. After each practice assessment, students receive a personalized score report showing outcomes in each main area. They're not going to be told exactly what question was missed, but what competencies to work on. This is to be sure they go back and study on areas that need help rather than just memorize questions or even continue working in areas that they're already confident in. After their practice tests, they can immediately launch their focused review. This helps for that further study in those areas that they maybe haven't mastered yet. We recommend that learners spend time in this review along with your course content before taking the next practice assessment. As we guide students through their NHA practice assessments, the most important resource we can guide them to is this review. Learners often think that simple exposure to tests over and over will improve their chances of passing. But NHA knows that a key difference for those who pass their certification exam is that they spend time between each assessment remediating and learning the content they had not yet mastered. Now, this is a separate tool specific to each practice assessment to help them focus further. It is printable, it is filterable, and helps to make sure that students are doing more study. We don't want them to shy away from reviewing their mistakes. It's also important to know that this is the one tool you don't have immediate access to, as it is unique to each learner and each attempt, but the learners do have access to this, and you can view the blueprint for the content that will be created in their review. The next phase of our conversation is to take a look at the performance analytics and reports available to you to see what your learners are doing. NHA's reporting tools have been a key element in identifying candidate readiness, starting with our detailed and downloadable PDFs and instant scoring. These have been a baseline of data and evaluation for our clients and learners. When we launched the P360 Vitals report in 2018, which it was applicable for the CCMA, CPT, CPCT, that's the patient care technician, and the pharmacy technician exams, we were able to provide an even more robust reporting platform, identifying areas of strength and weakness in candidates. The problem we realized was that we outlined these guidelines based specifically on the NHA recommended best practices for our resources. However, if your program or learner followed a different pathway, then the information provided would look as if the candidate who was otherwise completely prepared was not ready to sit for their exam. In addition, as we continue to grow and provide more and more learning resources outside of certification preparation, it became difficult to navigate and know where everything was. And this is when we started to rethink how to bring you your reporting. For the last year, the option to view the new reporting analytics has been available for anyone already using the Learning Insights and Vitals. This even more detailed analytics tool was able to help step away from how we thought you should be using your resources and put the power into your hands to define success, outline assessment, and growth. We started also to align all of our other learning resources from soft skills to didactic content to the newer skills builders and the updated landscape. These analytics are able to filter to individuals, modules, or specific assessments. You can see each learner or assessment completed and drive down into even time spent per question on an assessment, or the time in quiz attempts compared to study content. Educators are able to view the exact report provided to their candidates as well. This also provided the new Download Center with downloadable CSV files for easier grade reporting, as well as our legacy PDFs, which are also available there. Only now those are filterable based on the learners you want to see. As we move toward an even more streamlined platform, we now are able to combine all of this reporting that you may have into a single report, aligning learning not just in exam prep, but also across products. This is currently for any resources already within the Learning Insight Center and coming for all of the rest as we progress through this year. This now enhanced reporting experience is the primary source for data analytics for you and your learners. You can filter to the product, candidate, or module. And of course, we have not gotten rid of the PDF and CSV reports, but added new features to help as you develop your best program and learning experience. The vitals isn't going away either. Well, not entirely. The original vitals report was a powerful analytics engine designed to provide you visibility to what your learners were doing, where they were spending time, who needed help, and with what. As we enhanced this tool, it became so much more. So the P360 Vitals report may be going away, but the Vitals engine is not going anywhere. In fact, it's now the primary tool helping us with this process. The new report is called simply Performance Analytics, which now also combines the evaluatory analytics engine capabilities into a more robust reporting experience to offer a richer understanding of student behaviors, performance, and exam readiness with a predictive and prescriptive model that continuously analyzes a learner's use of study guide and practice test materials over time. The key element here is that the defining piece is no longer NHA's expectations of usage, but actually viewing real candidates across the country and comparing success rates with learner behavior. Vitals is a predictive analytics engine that compares each learner's behavior and performance in study guide and or practice test materials with those who have used these materials and successfully passed the certification exam. Due to this, the vitals element will only show as active when a learner begins their first piece of exam prep, study guide, quiz, or practice assessment. Though the new analytics will be monitoring learner behavior across the full course content, vitals will only become engaged when related to the NHA exam prep. As you can see here with the gray line versus the engagement statuses. Also, it goes without saying that no matter how much we can evaluate a given learner, there is never a guarantee for exam success. When looking at your benchmarks and evaluation of learners, I can't stress enough that the most valuable resource you have is you. You know them. You can observe their growth. Their time in study and continued growth through completed assessments is one of the best ways to gauge a learner, no matter what score you're seeing on an outcome or a test. Once learning content has been accessed for prep, Vitals will immediately place them into an engagement status. These statuses are formed again by comparing your learner to others with similar materials who have successfully passed the exam in their first attempt. Evaluating factors include material usage, progress, and performance, as well as time in the focused review, and even frequency of use, or how often do they return to the study materials. Engagement statuses are on track, meaning they are in alignment with where we've seen success. Developing, it means they may be behind or fallen short of what we're hoping for. And at risk, which outlines that their behavior does not look like those who have used these same resources and passed their exam. Now, you know your learners better than we do, so please keep in mind that these are guidelines only. One of the new features is now on our prescriptive element for suggested review. Once practice assessments are engaged, we can see those topics that may have fallen short. This is a filterable tool where each column can be selected and rearranged to the data based on your preference. And selecting a topic will drill down to a deep outline of the complete test plan, identifying all areas at risk and to what capacity. You can also go further, viewing each topic per learner. Your learners will have all of their own views as well. They can see everything that we've discussed except for the vitals engagement statuses. Those are for you. Their view provides them instead an outline of their performance across all practice tests individually and will provide visibility per core domain. We'll also open then to reveal a per topic missed list. And as with the historic reporting, selecting these links will automatically activate their focused review within that domain so they can begin their remediation before their next attempt. You can see this report from the Learning Insight Center for each learner in your course. There's a lot of information. We're going to transition now over to Kelly. She's going to talk a little bit more about how to use these analytics in your grading. Kelly, take it away.
Hi, everyone. I'm going to be discussing issues with you around the use of practice assessments and high stakes grading, how people determine those numbers and grades, often with an incorrect understanding, and some recommended best practices. The purpose of NHA practice assessments are to enhance your students' exam readiness, identify knowledge gaps and areas for improvement, both for your students and for your program, improve student confidence, and reduce test anxiety. Additionally, we strongly encourage as a best practice not equating raw scores to traditional letter grades and avoiding the use of practice assessments for high stakes evaluation. When interpreting NHA practice assessment scores, it is important to note that NHA practice assessment scores should not be equated to traditional letter grade assessments, such as commonly understood A for excellent, B above average with continued studied practices, C average and would benefit from continued study and focused review, D below average needing continued study and a pointed remediation plan, and finally F needing extensive improvement and remediation. Instead, raw scores should be contextualized and compared to national averages. This way, a lower score may still be average or above average when compared to those scores.
As Kelly said, practice assessment percentage scores do not align to academic letter grades as we're familiar, A, B, C, D, or passing, non-passing standards on the NHA certification exams themselves. Some institutions have mistakenly set benchmark or cut scores for their learners, requiring them to score above a certain percentage on one or more of the NHA practice assessments, believing that a certain percentage was a passing score and would indicate the best likelihood of passing the NHA certification exam. Because the NHA certification exams themselves use a scaled scoring methodology, not a raw score of accuracy, setting a percentage passing score on the practice assessment is not an accurate representation of learner readiness. The best indicator of success is the information provided to you in the Psychometrically Sound Learning Insight Center and your monitoring of your learners' readiness, progression, and growth.
Some examples would be a student scoring 70% on a practice assessment, which may seem like a C or just average. However, the national average could be a 65%, which would place your student significantly above the average. Another example would be student B scoring 60%, which again, we traditionally would think of as being below average or a D. However, if the national average were 55%, that student is still performing above the majority of their peers. Next, I'd like to demonstrate how benchmark or cut scores may not always reflect predicted student success or upcoming certification exam readiness. While we encourage programs not to adopt high stakes grading, it ultimately is up to institutions to determine their policy regarding benchmarking and cut scores. These cut scores become more stable with more data. And this is just an example to identify an appropriate cut score. This is not a crystal ball, and it will vary based upon the institution. Here we have 20 students who took a practice assessment. If you add all of these grades together and simply do an average, you could come up with a mean score of being 70. So let's set 70 as our benchmark. In doing so, you will see that 10 out of 12 students were able to achieve certification exam pass. In doing so, that gives us a predicted success rate of 83%. But now let's look at some alternatives in our table too. Here, we've decided to set the score much lower at 61% because the student actually did pass. In doing so, you can see this predictability rate is at 75%, which would be average. Next, if we look at our traditional 70%, we get, as before, 83% predictability rate. Now, if we set an average score of 75%, which most of us would think of as passing, this is average. This does give us a predictability rate of 100%, but look, only 7 of your 20 students were actually able to achieve that. Raising the benchmark results in a greater predictability of passing the certification exam, but with fewer students actually being able to achieve it. And again, disclaimer should be that calculations here are just an example. Individual institutions need their own data for review, and benchmarking is highly discouraged. Examples of high stakes exams include assigning letter exam grades, holding diplomas, and withholding permission to test. High stakes exams can create undue stress and anxiety for students, may not accurately reflect student learning or competency, and can result in negative impacts on student retention and program reputation. Instead, use a variety of assessments to evaluate student learning and progression, such as quizzes, projects, simulations, and clinical performance. NHA practice assessments are a valuable tool for allied health program success as they enhance student exam readiness, identify knowledge gaps and areas for improvement, and improve student confidence while reducing test anxiety. To maximize student learning and achievement, avoid practice assessments as high-stakes exams and implement best practices in your assessments.
As we recap our conversation today, I want to give you a couple final thoughts. And the first is the NHA certification best practices that are available to you for view in our implementation guides have been proven to help learners find some best preparation experience and outcomes on their exam. So when possible, please leverage those. We also recommend that you guide your learners to require the usage of that focused review for the best possible remediation and improvement on those scores. Of course, the Learning Insight Center we would recommend that you leverage along with other reporting to guide your learners to their best test preparation. Now, if you would like to have some one-on-one training on any of this specifically related to the reporting, please let your NHA representative know and they will connect with you and you'll get someone from the client experience team to schedule a one-on-one training. And in addition, if your institution currently uses a benchmark or cut score, and you might be a little concerned about that score that's been set based on what we've shared today, please email nhacxteam@ascendlearning.com, and a member of our team will follow up with you directly to get scheduled. Thank you so much for your time today, for taking time to watch this informative video. We know your time is precious, and we appreciate you being here with us to cover some very important information around scoring, assessments, and candidate best practices. Hey, Kelly, say bye to everybody.
Bye. Thank you for having me.
Have a wonderful day, everyone. Thank you so much.